Hello everyone, my name is Faith Asha. I represent the Girls Act in HF community. I'm also a young mother. My baby is like 8 months old. I'm really grateful for Global Fund because through them, there are lots of things that expectant mothers get. For example, you are tested free HIV test, and when you are positive, it's a walk, it's a journey that they help you get through. So I got my baby, I got a free net because of malaria. As you all know that they also deal with malaria and TB. So I'm really thankful because now in Kenya we can access free testing, free HIV testing for when you're pregnant. You get a free net, free mosquito net to curb malaria. And I'm really thankful for them that I can hold my baby and smile. Thank you. My name is Faith Asha. I represent the Girls Act community in Parklands AHF. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund a happy 20th anniversary.
Hi, I'm Beverly Kwamboka from Nairobi. I'm a youth representative within Nairobi. I can say the Global Fund has really helped me in many ways, and I thank God for them. Especially, I can say a short story or a version of what it has done in my life. Through Global Fund, my mother was able to be treated because she had TB, and now she's alive with us. And in many ways, I really thank God for the Global Fund, and I pray that they continue supporting other countries like us, Kenya, and will go far in a milestone that will always be productive and saving life in many ways. Hi, my name is Beverly Kwamboka. I represent the youth in Nairobi. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund happy 20th anniversary celebration. Thank you.
My name is Mercy Mtonyi. I work with Bar Hostess Empowerment and Support Program as a project manager for the Global Fund Kenya Red Cross Partnership Program. Under the Global Fund program, we implement a HIV prevention program for the female sex workers and their sexual partners. And through the partnership and the support of the Global Fund, we've been able to reach female sex workers with HIV prevention services and sexual reproductive health services through the drop-in center, the clinic, as well as an outreach model. Among the key strategies implemented under the Global Fund program is the peer-led model in reaching sex workers with HIV prevention program. And this has enhanced ownership of and uptake of HIV prevention services, including HIV testing, condom uptake, and also use of pre-exposure prophylaxis. And this has really worked because sex workers are now positive in uptake of HIV prevention services, and it has ensured that sex workers have maintained a HIV negative status, and also those living with HIV have also maintained their status. Beyond that, we've ensured that there's recognition of the sex workers in the health sector due to our advocacy strategies that has been supported with the Global Fund. My name is Mercy Mtonyi. I represent the sex workers community. I accept the Torch Caravan and celebrate the 20 years anniversary of the Global Fund.
Hi, I'm Mildred Ayuma. I'm from Madari community. Actually, I would like to thank Global Fund for providing for the events which have been helping most young people to nurture their talents, and as well as by since we have been using our talents to talk more about HIV, to pass information outside there, which has enabled most young people to come to the facilities to be tested and to know their status. And I would really, really appreciate them, and I will pray that God will provide you with much to continue helping young people and many people outside here. My name is Mildred Ayuma. I represent Girls Act from Mathare community. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund happy 20th anniversary celebration.
Hi, I'm Naomi Shisia. I'd like to thank the Global Fund for enabling us to change lives, for giving us funds, for buying medicines, providing mosquito nets. You've been able to give us drugs for TB, for malaria, and also for HIV. We thank you for the golden opportunity, and may God richly bless you. I'm Naomi Shisia. I represent Maria Clinic, AHF Kenya. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund happy 20th anniversary celebration. May God bless you.
Hello, I'm Peter Mwangi, a youth representative from Nairobi County. I'm a young person living with HIV since birth. It has not been a nice journey since being in HIV. It has affected me a lot, and through this, I would like to appreciate the Global Fund for what it has managed to do for us as young people. Through this, we have been able to provide medicine, that's RVs, and for TB, and also for malaria. We appreciate a lot, and I would like more to come and help our young people in our communities. My name is Peter Mwangi. I represent adolescent and young people. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund a happy 20th anniversary.
Hi, my name is Peter Wanjiru. I'm from Mathare. So one of the things that I appreciate Global Fund for is because when I tested positive, I was about 13 years. That's when I realized that one of the things that I made was that I never accepted myself. So it was so hard for me, even for adherence purposes, that I was hiding my medicines and I was not taking them. So one of the things that Global Fund has helped me is they have funded many support groups where I was introduced, and I was able to go there and meet a lot of people, my peers, who encouraged me to make sure that I'll be able to take my medication well. So I was able to be taking that journey of accepting myself, making sure that I'm able to adhere and become a healthy person once again. Because one of the things that was happening is that I was getting weaker and weaker, and also putting a budget on my caregivers by always taking me to hospitals, making sure that they're wasting a lot of time on me, making sure that I'll be able to come up again. But when I joined the support groups where I met my peers, people of my own age, they were encouraging me and making sure that I'm able to continue with my medication well. So that's one of the things that I really appreciate the Global Fund for. My name is Peter Wanjiru. I represent a community that people living with HIV. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund happy 20th anniversary celebration.
My name is Richa Mulvaney from Machakos County. One thing I'd like to appreciate Global Fund with is the provision of ARVs. This has helped me give back to a negative baby. Also, I'd like to thank them for the provision of nets because we didn't have any cases of malaria with my baby. My name is Richa Mulvaney. I represent the Young Mothers community. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund a happy 20th celebration.
Hey, hi, naitwa Solomon Kirui, natoka Nairobi, side za Mathare. Okay, mimi ni HIV positive, mwanaume, nimezaliwa nayo. Na kitu ya kwanza na thank sana the Global Fund kwa kutusaidia tuwe na access nzuri ya ARVs, wametupea free. Ziko ni vitu mob ambao wametupea. So mimi nashukuru sana Global Fund kwa hii journey. Okay, nilikuwa nimeisha by the way, but sasa niko normal. Nasema asante sana. Naitwa Solomon Kirui. Nashukuru sana Global Fund kwa kukamia. Okay, in me na accept sana the Global Fund, the Torch Caravan in Kenya, and also now wish the Global Fund happy 20th anniversary.
Hi, my name is Victor Karaoke. I'm from Kajiado County and a content creator. And one of the most things that I would love to thank Global Fund is the fact that I'm a young person living with HIV, and I've been living positive for the last 16 years, still living positively, and a powerful community advocate. And one of the things that I would love to thank Global Fund is the fact that currently we have PrEP, and I'm in a discordant relationship. My partner is currently on PrEP. There are a million other reasons I would love to thank Global Fund, but at the moment I would love to say thanks to the availability of PrEP and condoms. Asanteni sana, Kongoi. My name is Victor Karaoke. I represent the community of young people living with HIV. I accept the Global Fund Torch Caravan in Kenya, and I wish the Global Fund happy 20th anniversary.
Thank you everyone for joining once again. My name is Sam Makau, hosting this from an AHF facility in Mathare, Nairobi. And I'd like to thank all the partners for joining. Thank you so much. Please share your stories on social media under the hashtags I am one of 38 million and also the Global Fund at 20. At this point, I'd like to ask our Ugandan team if they're ready. Alice, are you there? Alice, are you there? Just to note that all these stories that we've shared today, which are part of our Torch Caravan, can be found on YouTube at our Waki Health channel. Feel free to have a look and also share. These are all very personal stories, as you've heard, from our different champions.
Hello, Sam.
Hello, hi.
Hi. So we are about to start. We are actually just waiting for the Minister for Health. But I think we can start in the meantime as the Minister comes. Possibly we can start with the introductory part, and just to start off with greeting all our colleagues, a good afternoon to you. Please hold it. All right, so I was making a consultation. I want to welcome our colleagues to this meeting. Good afternoon to you all. My name is Alice Kayongo. I am Senior Policy Advisor with Waki Health, and Waki Health is the Secretariat of the Global Funds Advocates Network. For the meeting this afternoon, we do have categories of individuals. I will speak on behalf of the categories from Uganda, and possibly my colleague Sam can speak on behalf of the categories from Kenya. From Uganda, we will have the Minister for Health. We will also have the Minister for Finance online. We will have the Director General for the Ministry of Health. We will have program managers, the CCM chair and other CCM representatives. We also have civil society colleagues. We have representatives of communities. We have journalists and officials within the Ministry of Health, as well as officials from the Ministry of Finance. And all these categories are participants that we have both online, but also in the room at the Ministry of Health boardroom. I would like to hand over to my colleague, Tabeth, to take us through, to basically give us welcome remarks so we can proceed. Tabeth, over to you.
Honorable Ministers, Director General and Permanent Secretaries, CCM chairs and CCM representatives, program managers, civil society, comrades, community representatives, and all stakeholders. We at Waki Health as GFAN Secretariat and coordinator of this Torch Caravan, celebrating Global Fund 820, are excited and honored to welcome you all to this meeting. We appreciate the support and participation from all African countries who have and still are to host the Torch in celebration of Global Fund 820. The Global Fund's impact on Africa in Africa extends not just to Uganda, to the Republic of Uganda, but to the whole continent. In honor of the Global Fund support for the region and the continent over the last 20 years, the Torch Caravan is making its way throughout Africa, mimicking the Cape to Cairo route, crossing over country into country and several Africa regions. The Torch Caravan is a great opportunity to raise awareness about the disease burden and show our appreciation for the Global Fund's interventions and impact. Even with the issues like political unrest and COVID-19 restrictions experienced in different countries in Africa, we stand together and continue to shed light on how to improve lives. We acknowledge the dedication and hard work that is contributing to the success of receiving and handover of the torch since it left South Africa on July 14th. It's passed through to Zimbabwe, Malawi, Zambia, southern region, and then it came into the East region, starting off in the Republic of Kenya and crossing over now into the Republic of Uganda. This will continue until the torch makes its way back to South Africa at the ICASA conference in December 2021. Celebrate with us right today, this moment, as the Republic of Uganda, as you receive and host the torch. We also celebrate the Republic of Kenya as the host and as the previous host and many other previous hosts and the future hosts of the torch. We thank you.
Thank you very much. And colleagues, we are being reminded that we are having this Torch Caravan as one of the celebratory moments, celebrating the Global Fund 20th anniversary. We all know what the Global Fund has done in improving lives of individuals in different countries, different regions. And today we are talking about this in Uganda, but as well as in Kenya. We started this journey, as Tabet mentioned, we started this journey a while back, and one of our colleagues, Nombasa Sizwe, will be taking us through what the background of the Global Fund at 20 Torch Caravan. Nombasa, over to you.
Good afternoon, everyone. As Alice has said, my name is Sizwe Nombasa Xuluwe. I'll just want to say all protocols observed. I am not really good with following who's coming after who, so hence I'm just using the all protocols observed. I'm representing GFAN Africa and Waki Health, which is the organization that is a secretariat to GFAN Africa. GFAN Africa in full is Global Fund Advocates Network in Africa. The purpose of the platform is to advocate and support the Global Fund replenishment as it relates to the domestic resource mobilization for health. So we as civil society, it's a civil society driven initiative that we partner with Global Fund and our own governments, communities in our own countries, and even in the Africa region to make sure that there is investment in health. In this era, we are celebrating the 20 years of impact of Global Fund, as Global Fund has been in existence since 2002. And since its existence, to date, the contribution of Global Fund in our own health in our own countries has resulted in 38 million lives saved. So now we are on that path and journey to celebrate the Global Fund and also documenting and sharing our own journey as civil societies working with our partners in the partnership with Global Fund. Then the program that we are in is called Global Fund at 20. In that program, we're having different activities that we are planning to do all over Africa. One of the activities is video recording, where we request the communities affected by HIV, TB, and malaria to document their own experience, as we've seen as my colleague Sam has shared the videos from Kenya, where they share their own stories of how did the Global Fund contribution in country save them as the beneficiaries or as the people that have been involved in implementing the programs. Also, we have what we call the digital album. Digital album is what we are collecting pictures, newspaper articles, and all that from civil society members and our partners that people were engaging in terms of maybe calling for the establishment of the Global Fund, or even in the processes of Global Fund, like the replenishment, the funding process, and all that. So we also writing that story. The other part, we're also working with parliamentarians to give their voice in terms of what they have engaged and what would they want to see as Global Fund taking the future and what will be their message to the outside world in terms of the Global Fund work. And then the program we're talking about today is called the Torch Caravan. The Torch Caravan is focusing on 20 countries in Africa. And as my colleague Tabitha has already echoed, is moving at a concept we called the Cape to Cairo. So it will be moving on 5 regional blocks of Africa, starting from the Southern Africa, making its way to East Africa. After East Africa is Central Africa, West Africa, and the last region will be MENA region. And after that, the MENA region, we're hoping to have the close of ceremony of the torch in Ikasa in December. So now that's how we
GSK, of course,
are planning
breaking the kids down.
the
Right now, there was Sanofi, but I don't know what's going to happen. But
the 20 years of the Global Fund. So as already echoed today, we now, the torch last week was passed from Southern Africa region to East Africa region, and it was received by Kenya. And today, as it sits in East Africa region, the torch is then passed to Uganda. So I will stop at that, and thank you for giving me the time. Thank you.
Honorable, can sit here. That looks a bit horrible.
Sam, could you kindly play a video as we wait for our minister and the officials from the ministry to settle in?
All right, 1 second, please. We'll queue in messages from Kenya, from the handover from Zambia in the next few minutes.
Kenya Red Cross has been non-state peer implementing the HIV grant since 2012. We are grateful for the Global Fund support that has enabled us to facilitate greater access to services by communities, particularly the most vulnerable and hard-to-reach population. Through the Global Fund HIV grant, Kenya Red Cross has successfully strengthened the capacity of 73 sub-recipient organizations, including networks of persons living with HIV, young people, and key populations affected by the disease. This has enabled them to advocate for access to their rights and services and to monitor service access among the communities. Since 2012, we have reached over 2 million Kenyans with biomedical, behavioral, structural differentiated service delivery, and age-appropriate interventions. This has significantly contributed to reducing HIV infections, increasing treatment uptake, and reducing AIDS-related deaths in Kenya. On behalf of the targeted communities and the sub-recipients, Kenya Red Cross thanks the Global Fund and the Kenya Coordinating Mechanism for giving us the chance to contribute to the march towards ending HIV. My name is Dr. Asha Mohammed, Secretary General, Kenya Red Cross Society. I represent the non-state PR. I accept the Torch Caravan into Kenya and celebrate the 20 years anniversary of the Global Fund.
Hey, hi, naitwa Solomon Kirui, natoka Nairobi, side za Mathare. Okay, mimi ni HIV positive, mwanaume, nimezaliwa nayo. Na kitu cha kwanza na thank sana the Global Fund kwa kutusaidia tuwe na access nzuri ya ARVs, wametupea free. Ni vitu mob ambao wametupea. So mimi nashukuru sana Global Fund kwa hii journey. Okay, nilikuwa nimeisha by the way, but sasa niko normal. Nasema asante sana. Naitwa Solomon Kirui. Nashukuru sana Global Fund kwa kukamia. Okay, in me na accept sana the Global Fund, the Torch Caravan in Kenya, and also now wish the Global Fund happy 20th anniversary.
My name is Dr. Githuka George, head of the Division of National Malaria Program, the Ministry of Health Kenya. Malaria in Kenya remains one of who are tested for malaria, of whom 4.5 million of them were found to be positive. All these people who were tested positive for malaria were treated using the first-line recommended treatment, which is the AL. And for those who had severe malaria, they were also treated appropriately. Through the support of the Global Fund, they have been able to implement various malaria prevention interventions in the country. The major one being the use of long-lasting insecticide-treated nets for malaria prevention. Global Fund supports the mass distribution of nets to areas where transmission happens. An example is that this year 2021.
Thank you very much, Sam, and thank you for sharing those videos. Apologies for the lag in time, but we really needed to have it. Members here, the government delegation here, program managers, the Director General, the Permanent Secretary, the Minister, we thank you so much for honoring our invite to join us today as we celebrate the 20th anniversary of the Global Fund. We are here having been convened by the Global Fund's Advocates Network in Africa, which is hosted by Waki Health, based in Nairobi, Kenya. We are in the middle of an event that we have referred to as a Torch Caravan, where the torch is being moved from country to country in 20 countries of Africa, each country representing at least 1 year's anniversary in the region. The torch has moved from Southern Africa to Eastern Africa, and in Eastern Africa, it has been in Kenya. Today in Uganda, we are scheduled to receive the torch, and the Minister for Health will be receiving the torch on behalf of the government of Uganda. I would like us to now formally open this meeting with remarks from the Ministry of Health in Uganda, as well as the Ministry of Health in Kenya, after which we will move on to remarks from the Global Fund Secretariat in Geneva, specifically from the Head of Political and Civil Society Advocacy, Ms. Linda Mafu, and from the Country Portfolio Manager for Uganda, Mr. Saman Zamani. I would request the Director General of the Ministry of Health to lead us through the opening.
Thank you very much for this very important occasion. I do want to introduce the delegation from Government of Uganda which is here. I think we can take this opportunity to introduce at least those who are here physically, but there are also those who are online. I don't know how we do that. But for us who are around, let's start with Abby, because the people would want to know who witnessed this receiving ceremony.
Good evening. My name is Abhiram Kanamaka. I work as a communications officer at the Ministry of Health.
Good evening to Richa Mulvaney, Assistant Commissioner in charge of TB representative Minister of Health. Dr. Helen Katamba, National Facilitator, Global Fund. And online, there is the Program Manager, Malaria Control Program, Dr. Jimmy Okigo. There is the Program Manager, HIV/AIDS Program, Dr. Joshua Msinguzi.
And their staff?
Yes, their staff.
Are you hearing us, colleagues online?
Yes, we are. Good afternoon, Chair.
Thank you very much.
Yes, we do.
Henry Mwevesa, the Director General of Health Services.
My name is Diana Atwina, the Permanent Secretary of the Ministry of Health.
Hanifa Pangirana Kawoya, the Minister of State General Duties.
Jane Ruth Acheng is my name, the Minister for Health.
Thank you very much, Honorable Ministers, peers and colleagues. We are here on a very important function of receiving this torch, and we appreciate, Honorable Minister, the support we have received from the Global Fund for the last 20 years. I'm aware that Uganda was one of the original recipients in receiving Global Fund support, and this support has been around since 2001. It has helped us improve services in HIV, malaria, and TB. As of now, together with other partners, we are starting with HIV, for example. We have managed to start 1 million.3 people on antiretroviral drugs out of the 1.4 million. We have been, and plus other preventive services in HIV. We have also been able to support preventive services in malaria, especially net distribution and others, but also treatment for malaria. We have also been receiving support through the Global Fund in the TB program. This has helped a lot in case finding and treatment of all TB patients. We have about to receive about 100,000 patients of TB every year, and we've been able to support all those under the support of the Global Fund. So as a country, we appreciate the Global Fund over the years, and we work very closely with the Ministry of Finance, we work very closely with the Pricewater, and also with the program, with our fund management agent, but also with the team in Geneva, and we interact regularly, we guide each other, and usually we do a lot of interactions regarding to supporting the program, a lot of consultations and preparation of our work plan in order to support this program. So we appreciate that this gesture has been done to appreciate the role of the Global Fund over the 20 years. It was really timely, and I want to thank the GFAN Africa for arranging this very important function. So thank you very much. I want to hand over to the Permanent Secretary to make her remarks.
Honorable Ministers, on our team, those who are online, thank you for coming. Thank you for organizing this meeting. I don't want to repeat what Director General has said, but I want to thank Global Fund for the milestones that we have achieved as a country. We have reduced malaria significantly in the country. We have extended the care to so many people, as you heard. The TB was a big problem at one time, but we are successfully bringing it down as we continue strengthening our treatment and strategies. So we couldn't do this alone, and that's why we are appreciating your support. We want also to thank the civil society that has been working with us in this endeavor. We want to thank the CCM and the Global Fund team in Geneva, with whom we have worked very closely. With that, I want to welcome the Minister. Okay, so I just want to stop here. I don't want to preempt, because I know that my Minister will say a little more, and want to thank you so much. And we are eternally grateful for all the things that we have been able to achieve. Thank you.
Thank you very much, Dr. Atwine, the Permanent Secretary of the Ministry of Health Uganda, and thank you, Dr. Melesa, the Director General of Health Services, Ministry of Uganda. At this point, I would like to hand over to our colleagues in Geneva, the Head of Political and Civil Society Advocacy, Ms. Linda Mapu. Welcome, Ms. Linda.
Thank you so much. First of all, I'm going to try and manage my protocol issues. To the Minister of Health, Minister of Finance, the directors of CCM, the directors of program, the civil society partners, and the multilateral partners, I'm still going to say all protocols observed, just in case I have not called on everyone. Greetings from Geneva, and I'm also sharing greetings from our Executive Director, Peterson, who is unable to join us in this call. First of all, I'm a South African. As much as I'm working in Geneva and I've been here for some time. As a South African, I know that 20 years ago, we were in a place where we were going to funerals every day. We were burying our loved ones Monday to Monday. We had new infections at a rate of 1,500 per day. And that was quite challenging for us. We currently have over 7 million people that are living with HIV in South Africa. So as a South African, I was touched in many ways by HIV. I was touched in many ways by TB at a very personal level. Now, I knew that people were dying of a preventable disease. I knew that people were dying of a treatable disease, but because they were poor, they could not afford to pay for their own treatment. They could not afford to buy their own prevention technologies. So it was quite challenging. We fought in many ways. I was one of the activists that were on the streets all the time, calling for access to treatment, calling for access to prevention technologies. We called for a fund that would be able to support people to access treatment, that would be able to give us a level ground for everyone to have equal access to treatment, irrespective of their inability or ability to pay. People that were able to pay for their own treatment were surviving, but the poor people that could not afford to pay were dying, and it was unnecessary there. We used to start our meetings with a moment of silence because everyone was losing family members. Everyone was losing someone, a friend, or there were people that were losing children. So it was quite a challenging time. Now, fast forward to 20 years, we are now at a point where we are celebrating saving over 38 million lives. And how did we do this? We did this through partnerships. We partnered with civil society. We had civil society at the center of the response. We had communities that are affected by the diseases at the center of this. And therefore, Global Fund became a game changer. It became a game changer in terms of ensuring that people are accessing treatment and health services without experiencing financial difficulties. So households were able to access services without experiencing financial hardship. And that was quite important. And therefore, the ground was leveled. Global Fund came about as a result of being unwilling to accept the status quo at the time that was saying, if you are rich, you can live. If you are poor, you will die. We had a point where all global leaders were saying that we can contribute. We are a global village. We can contribute and make sure that everyone have access to treatment. We are here where we are celebrating 38 million, saving 38 million lives because there was leadership. There's political leadership from our own government. There was political willingness to save lives from our own government. And also there's commitment to finance and also go into a global solidarity to finance the treatment, to finance the services. When we talk about the replenishment at the Global Fund, in the 6th replenishment, we got our own African government contributing to the replenishment of the Global Fund. So that means we are a real global village that is saving the lives. There was contribution from different countries in Africa that were supporting us. There was also an increase in domestic allocation of resources to health, which is very key and very important because it enables us to leverage resources from donors. Without civil society and communities at the center, holding us accountable, following up on the programs, calling us when we are not doing well, to go back and get back on track is quite important. Without civil society leading and supporting the national responses to HIV, TB, and malaria, we would not be where we are. So thank you very much. I'm thanking the government, I'm thanking civil society, I'm thanking the multilateral partners that have enabled us to think, particularly providing technical assistance so that we are able to really have high impact intervention. Thank you so much. Thank you for organizing this event. It's really important. It is about civil society, it is about communities, it is about the government, it is about the Global Fund partnership. So we really appreciate the work that you are doing. Yes, please keep sending us the videos, the messages, everything else, because celebration is about sharing those memories. So thank you so much. Join us and join our hands in fighting the new pandemic, because the new pandemic now has a potential to really take us back 10 years, really having an impact in terms of the progress that we have made. So we need your support, we need your expertise, we need your innovation to really make sure that we win this, because in the past 20 years, we were saying saving lives. But now in the next 20 years, we are saying we need to defeat all the 3 diseases as public health threat. We don't need our children to talk about HIV, TB, and malaria. They need to face other challenges. So thank you so much for your support, and all the best, Uganda, for accepting the torch. And we look forward to celebrating with you. And also, hopefully, we'll be able to see some of you at the ICASA, and it becomes a whole continental celebration. Thank you so much.
Thank you, sister. Those were that was very interesting. Thank you so much. We do appreciate. And indeed, we are holding hands. We will hold hands with the Global Fund Partnership again against the new pandemic, the COVID-19 pandemic. I would like to call on the Uganda Portfolio Manager, Mr. Saman Zamani, to give his remarks as well.
Thank you very much. Good afternoon, Honorable Minister, distinguished colleagues, all protocol observed. And hello and good afternoon to Kampala and Nairobi. It's a shame I couldn't be with you for this celebration, but I'm taking advantage of this technology. Thanks for extending the invite to me as well. Linda, led from our side and appreciate her motivating and encouraging messages to all of us. From Uganda side, we do see ourselves as a big Team Uganda, country team, LFA, PR, civil society, partners, CCM. To me, this is an excellent partnership we are benefiting from, and we are looking forward again expanding this partnership as we have been doing during the NFM2 and NFM3. We have now even additional ministries part of our partnership, and we are really excited about this. Thanks to leadership from Minister of Finance, Minister of Health, we are very excited about the progress you are making in 3 diseases, as well as health system strengthening. Again, as Linda highlighted, we value a lot our strong partnership, and that is how we are observing the synergistic effect of many different contributions, government, civil society, multilateral partners, and many other stakeholders. Again, the progress we have made in HIVs is tremendous for TB. As senior management and Watch highlighted, we are very excited with additional case funding and increasing treatment coverage. Congratulations to both HIV and TB team. For malaria, we are very supportive and appreciative of the successful LLIN campaign just concluded this year. And again, so for Linda's attention, Uganda has been leading on community and stakeholder approach for malaria control. It's called MOM. And this is one of the best examples we have in the region, engaging with district, parliamentarian, as well as other stakeholders. So all excellent examples. We hope to be able to also document your good and excellent work and sharing with other implementing partners as we go along. Appreciation of civil society partners. You're always there to guide us and raising a voice of community members, which we are to contribute. Thanks again for the all partners and PRs and Ministry of Health officials. Thanks again. Congratulations to both Uganda and Kenya receiving this torch. It's excellent, innovative during a time of difficulty, and I hope you're all keeping safe and enjoying this moment of celebration. Thanks to all of you. Back to you.
And thank you so much. We appreciate your remarks. At this point, in the interest of time, I would like to refer to the Kenya side and call on the government of Kenya to give remarks, hand over, as well as handing over the torch to the ministers present today, the Minister of Health, as well as the State Minister. Sam?
All right, thank you so much for all the introductions, all protocol observed. I'd like to take 2 minutes of your time to just introduce Ms. Lilis Njagi, Africa Director, Malaria No More, for 2-minute remarks, and then we'll hand it over to our KCM Vice Chair, Faith Mwende, to take it up, give her remarks, and hand it over to Uganda. Ms. Lilis, are you on?
Yes, I am. Thank you very much for the opportunity. My name is Lilis Janga from Malaria No More, and honorable ministers, government officials, CCM representatives, civil society representatives, ladies and gentlemen, all protocols observed. The 20th anniversary is a mark of battles won, lives saved, and progress made in countries affected by HIV, TB, and malaria. As we celebrate this important moment in history, and speaking from a malaria perspective, I can only imagine the joy of a mother whose child 20 years ago had malaria, and due to available resources, early diagnosis and treatment, her child has today completed school and is either in higher learning or entering the workforce. Malaria holds us back. This disease can be a drain on economies, keeps children out of school and adults out of work, bringing down productivity, contributing to the cycle of poverty, and limiting the potential of children. But with continued and sustained investment on malaria and HIV and TB, this can and will be in the past. In countries where a global fund invests, malaria deaths have significantly reduced. The success in fighting back malaria has been possible through the investments of the Global Fund. Kenya, like so many other countries, stands at crossroads in our fight to beat malaria. We will go forward and eliminate this disease in one generation, or will stand or even slip backwards. All this means that the replenishment of the Global Fund, the upcoming one, and the collaboration, we will be able to defeat malaria and indeed HIV and TB. It will be imperative that we do not lose sight of the success that the Global Fund has yielded, as our attention is focused on COVID-19. The battle against COVID-19 cannot be seen in isolation. We must see this not just as a fight, not just as a fight against this specific virus, but as a catalyst to finish the yet unfinished fight against HIV, TB, and malaria, and to strengthen preparedness against future diseases. In Kenya, the progress on malaria is one to note due to the political goodwill from His Excellency President Uhuru Kenyatta, with the recent launch of the first Malaria Youth Army in Africa, a great step to engage the youth who we hope will be the generation that ends and sees the end of malaria. We have also seen the unveiling of the first locally manufactured diagnostic kit and utilization of drones for larvicide spraying in breeding sites. It is important to recognize that this progress and achievement is the result of efforts by a wide array of actors who make up the Global Fund partnership. The Global Fund helps deliver effective partnerships between donors, such as the United Kingdom, and endemic countries such as Kenya, in a way that has changed millions of lives. When you have a partnership this successful, it is even more important that we maintain it during times of crisis. We call on all of us here as partners to support this initiative, and indeed, we celebrate this moment, and we wish a great 20th celebration. Thank you very much.
Thank you so much, Lilis. At this point, I'd like to welcome Faith Mwende.
Good afternoon, ladies and gentlemen. To the Global Fund team, Honorable Minister, to government representatives, CCM members from Uganda and the East African region, CCM members from Kenya, and I thank you, my colleagues. I've seen quite a number of you in this forum. Thank you so much for joining. community members, civil society representatives, development partners, ladies and gentlemen. It's my pleasure to join you during this important occasion as we celebrate Global Fund at 20. Last week on the 13th of August, the Republic of Kenya received the torch from the South African region, which was represented by Zambia. And during that event, the chair of the KCM, who is also the Principal Secretary, Ministry of Health, highlighted the achievements and how the Global Fund has continued to supplement the government of Kenya's efforts in prevention and control of HIV and AIDS, tuberculosis, malaria, COVID-19, and strengthening community as well as health systems in Kenya. Upon reception of the torch on the 13th of August, we've had a series of events and activities, including media engagement, sharing of experiences like what you've just seen, and success stories to commemorate the 20th anniversary of the Global Fund. Ladies and gentlemen, at this point, I'd like to continue as we continue to strengthen the Global Fund partnership and working tirelessly to protect and life-saving HIV, tuberculosis, and malaria programs, and continue supporting health and community systems. I would really like to appreciate this collaboration and the partnership, and also for the forum that we are having to commemorate and also hand over the torch. So with, on behalf of the CCM and the Republic of Kenya, I'm really honored to hand over the torch today to the Republic of Uganda. May this torch strengthen global and regional partnership and light our way as we work towards zero HIV, TB, and a malaria world. So, ladies and gentlemen, we really appreciate that virtually we will be sharing and handing over this torch to the Republic of Uganda. And significantly, we are handing over the torch, as you can see from the community members with us here. With those remarks, thank you so much. It's been a good journey, and we appreciate that we've held the torch and we hand over the torch to the Republic of Uganda. Thank you.
Thank you very much, CCM Kenya. And, for those who were not able to see what was happening in the room in Uganda, it's that everyone in the room has been waving the flag, thanking Global Fund and the flag of Kenya, flag of Uganda, as we receive the torch. But I would like to request the Director General to invite the Minister to be able to receive the torch. I beg your pardon. I will I do invite the Minister of State to be able to invite the Honorable Minister. Sorry, to be able to invite the Honorable Minister to light the torch.
Good afternoon, everybody. We're going to say thank you, Global Fund. Thank you. Go to the name of the Father, the Son, and the Holy Spirit. I request that you put on your masks. Just Adjust the screen to move closer.
Our colleagues online, we request for your pardon. We would like to invite the CCM chair of Uganda to make his remarks, after which we will have a representative from civil society, and then we will have the minister give her remarks and later close the meeting. The CCM chair.
Thank you very much. I hope you can all hear me. Honorable ministers and the leadership teams from Kenya and Uganda, CCM colleagues, civil society colleagues, and other partners, all protocol observed. A warm good afternoon to you all. I too, like our other colleagues, are sad we could not be there physically to attend this exciting event. But nevertheless, we are happy to be part of this through Zoom. Again, my name is Andrew Musoke. I'm the board chair of Uganda's CCM. Allow me to start by congratulating the Global Fund for reaching this momentous milestone of 20 years, improving and saving millions of lives in the fight against these diseases and strengthening our health systems. With support from Global Fund, Uganda has made tremendous progress over the years, and this has always been in collegial partnership with Uganda's ministry leadership and civil society. And like some colleagues said earlier, it's been really a tremendous template to show the important role of marrying political leadership and civil society in driving response efforts. I use this opportunity to thank the Honorable Minister of Health, who will be talking to us shortly, and representing the government's health efforts here, for her leadership for these tremendous initiatives in the fight to defeat HIV, TB, and malaria in Uganda. To the Global Fund, kindly accept our appreciation for your continuous support to us as a country in the prevention of these diseases. I have only been chair for the past 6 months, but in just these 6 months, the collaboration around the COVID-19 funding that the Global Fund has extended to Uganda has really shown a deep and collegial relationship that the Global Fund has with the people of Uganda. And so we thank you for that. On behalf of the Uganda CCM, I thank you warmly, and we welcome and accept the Torch Caravan from our Kenya colleagues. Thank you, and back to you.
We thank you so much for those remarks, Mr. Musoke. And at this point, I would like to invite my colleague and friend, Ms. Dora Musinguzi, to present, to give remarks on behalf of civil society organizations.
Thank you very much, Alice. Honorable Minister, Minister of State, the key dignitaries and delegates of the Ministry of Health, our colleagues and partners online, civil society organizations online, and communities. I am Dora Chichoncho Musinguzi, and I am the team leader at Uganet. We are glad to be in this meeting today to represent the broader voice of civil society organizations. It's because we don't have enough time, I wouldn't be speaking on behalf of communities. but communities are online and they gave me permission to speak in the broader umbrella of communities and civil society organizations. Thank you. Honorable Minister, today, as we receive the torch from Kenya, as civil society actors, we want to say that we celebrate. We celebrate so much the leadership of governments. We celebrate in particular your leadership, Honorable Minister. To be very brief, our celebration is going to hinge on 4 key areas. Over the years, we see that the Ministry of Health, the health sector, has included space for civil society participation. More than ever before, we are on the table. More than ever before, we feel seen and we feel heard. We see the integration that is within diseases. Previously, we mostly spoke HIV, but we believe that we have seen that you cannot win one and lose the other. We feel integrated as a community that is addressing HIV, TB, and malaria. We thank you. We feel that communities, we see that over the years, communities have been more integrated for who they are, the people living with HIV, several on the call. We have survivors of TB, people that have had TB. We are yet to properly actually name the communities of people that have achieved the battle against malaria, but we know that our communities all over the country have fought malaria and won malaria. We also recognize the place of key populations, key and vulnerable groups that include a number of actors, including people with disability. We also celebrate the fact that we have been included in resource allocation. 20 years later, we are grateful for TASO. That with this mechanism that was a partnership between government and TASO, civil society organizations have access to global fund funding. Particularly in this NFM3, 325 organizations, CBOs are going to receive funding in 56 districts. There are 13 SRs and 6 SSRs. This is a number that we could not boast of previously, but right now, resource allocation puts us at the core of the national response to HIV, TB, and malaria, and to us, this is a critical win. The last point, Honorable Minister, is to celebrate the very hard question around human rights. We believe that more than ever, addressing human rights barriers to access has been a particular win. We are more proud of the Ministry of Health because we know that you're introducing a health bill in Parliament, and that the health bill is going to deal with issues we thought were in conflict with public health issues, some of that including issues around criminalization of HIV. Through you, Honorable Minister, we would like to appreciate His Excellency the President, who, for example, just yesterday or a few days ago, sent back the sexual offences bill to be reworked because, Honorable Minister, there were going to be gaps between access to services and the populations that needed to be protected and issues around criminalization of HIV. As civil society organizations in Uganda, we recognize the leadership of the ministry. We offer our support. We offer to work with you more in partnership. Yes, we shall be activists, but we are choosing Uganda first. We agree with what you're doing. We agree that, for example, now with COVID, we need to integrate more than we have done previously. And the members on the team, the members on the call, agree that more than ever, this is a very critical and important intervention. So as we receive the torch today, as actors in civil society, we are grateful for the support of Global Fund. We are grateful that we are on the table. We are grateful that we can be heard. We are grateful that we have some resources to do this work. Thank you very much. And we are grateful for the space that this event was hosted here at the Ministry of Health. Over the next 5 days, when the torch is in Uganda before it goes to Ethiopia, civil society organizations will be having webinars to share what we have learned over the 20 years, what this grant has achieved over the many years. And indeed, we ask that indeed government can also invite us to the activities that they will put together. But definitely this is an invitation for more dialogue and more debate about what we've learned over the 20 years. Thank you very much.
Thank you so much, Dora. I would never repeat what you have said. Very, very important issues. And once again, I would like to return to the Minister of State to request you to call on the Honorable Minister of Health to give remarks as we have received the torch.
Thank you so much.
Good evening, celebrants. And as we celebrate this historical occasion of Global Fund 20th anniversary, allow me once again on behalf of the celebrants here present and those online to say thank you so much, Global Fund, and we look forward to working together with you more closely. And allow me at this juncture, mindful of time, to invite the Honorable Minister of Health with the honor to receive the torch and to make her own few remarks. Honorable Minister, you are most welcome to receive the torch and make your remarks. Thank you so much. Thank you for your time. Gentlemen, I request that we don't proceed without a mask for purposes of recording. Civil society organizations, GFAN and Watch Health, the head of political and civil society advocacy, our country portfolio manager, government officials of Kenya, my permanent secretary, director general and teams, and my dearest sister, the Minister of State for General Justice. First, allow me to welcome the civil society with the caravan into Ministry of Health. You're most welcome. And to appreciate you in a great way for the long journey that you have been moving, but also for the great passion that we have, passion and love that we have for the Global Fund. Allow me also to appreciate and congratulate the Global Fund on its 20th anniversary. Before 2001, the entire health system looked bleak because of the high burden of AIDS, TB, and malaria. And indeed, Uganda was one of the countries with the highest prevalence of HIV/AIDS. Our president took a bold step and came out openly to say Uganda is highly affected and Uganda needs help to fight HIV, TB, and malaria. And in a special way, we want to appreciate the Global Fund for AIDS, TB, and malaria. Since 2007 to date,
the total commitment from the Global Fund has been US dollars 1.7 billion. And total disbursed is US dollars 1.6 billion. All these billions of shillings have put a smile on several faces, improved qualities of lives, and given hope to the majority who otherwise would have either lost their lives or been living in a situation that would not be desired. To date, Uganda 1.3 million people on treatment. 1.3 million people on treatment are people who are contributing to the economic development of this country. Annually, Uganda treats over 65,000 people with TB, the majority of whom improve and go out into the communities to spread the message about available free drugs. In 2020-2021 alone financial year, over 12.8 million people received care and treatment for malaria. From these statistics, we see the value of partnerships. We see the value of holding hands together. We see the value of talking to one another. We see the value of collective efforts. And therefore, on this special day, when we receive the torch, which has a unique color that is very special to us, we want to appreciate in a special way the Global Fund and to appreciate the civil society for this initiative that makes us reflect on the goodness and strength of partnerships. Allow me to appreciate the government of Kenya for taking care of the torch very well and handing it over. And Uganda similarly pledges to do the same and hand over when the time is right. Handing over does not mean we shall forget. It means we shall continue to work hard and reflect on the goodness of Global Fund, to which Uganda is also a contributor. In a special way, I would like to appreciate our country coordinating mechanism chair and members, and to appreciate the program managers of HIV, TB, and malaria. And also appreciate our accounting officer for the enormous work that they do to ensure that we have value for money, for every dollar that is contributed by the Global Fund. Without the civil society organizations, our impact on the ground would have been limited. And so allow me in a special way to appreciate and congratulate the civil society organizations for a job very well done towards making us achieve our goals of 2030. Uganda is on track, and we know for sure that come 2030, we will end AIDS, end TB, and also ensure that malaria is no longer of public health importance. So once again, to the Global Fund, congratulations on the 20th anniversary, and thank you very much for the support. And on behalf
of the Ministry of Finance, Planning and Economic Development, on behalf of the government of Uganda, we want to say a big, big, big thank you to the Global Fund, and a big thank you to the government of Kenya for handling it. And to all of you,
we thank you so much, and indeed we are committed as civil society to join hands in ensuring that by 2030 we have HIV or even TB in Uganda. At this point, we are about to come to the meeting, and I will request the minister to take a picture with the members in this room, but at the same time, to deeply appreciate all the members that we have online, all those from Uganda, all those from Kenya, from Geneva, and from all other places from which you have been calling or dialing in. Thank you so much for making the time. Let us continue with the good work that we have been doing. Hold the torch, keep it lighting. Even when we hand it over to Ethiopia on the 23rd, activities will still go on in appreciation of the Global Fund Partnership, but also in celebration of this 20th anniversary. At this point, I would like to hand over to my colleague, Sam. Sam, if you have any remarks from Kenya, closing remarks, this is the point, but otherwise we are ready to take a picture this side in Uganda. I hope the Kenya team can be able to take a picture too. If not in person, you can possibly take it on Zoom. Over to you, Sam. All right, friends, thank you so much. We will take a picture since our minister has given her remarks and closed the meeting. We will take a picture right now. Thank you and have a very good evening. Thank you.